Tonight's lecture is going to be in, if you go to MBLEx and then you click on body systems, for right now, this lecture is in cardiovascular/circulatory. We may actually, I may move that. I'm trying to organize and name things so that they're clear, so that they concur. What I mean by clear is that they concur with the FSMTB study guide, and that way you can look at the study guide and the names of the section correspond to the names of the presentations, etc. All right. So of the body systems, I just want to remind you guys that there is disagreement, like many things in anatomy, physiology, kinesiology, etc. There is disagreement or lack of concurrence about how many body systems there are. Some people say that there are 11 body systems because there are 11 systems in the body, or 11 organ systems in the body. Other people say, well, yes, there's 11 organ systems plus one functional system, which is the immune system, which is based on its function and draws its tools from the other body systems, like the lymphatic system, the integumentary system, the respiratory system, nervous system, endocrine system, all play a role in mitigating the immune response. When you look at the circulatory system, likewise, there's disagreement about like what to call it, and some people will be more strict than others. I'm here to tell you it really doesn't matter. As long as you have a clear picture in your mind of what the question is asking you, then that's really all you need. So some people will call it the circulatory system. Some will call it the cardiovascular system. In some forms of physical training, you'll hear it referred to as the cardiorespiratory system, because they're including the lungs, right? And it's kind of hard when we go over the circulation. You'll see it's kind of hard to separate the lungs out from the heart. The heart and the lungs, they work so intimately together because it's the job of the heart to move oxygenated blood and to move deoxygenated blood and to get them to the right places. And the lungs are an essential part of that. Without the lungs, we wouldn't be able to do any of that. So the study points. So the first study point from the FSMTB e-study guide is to understand the various ways that massage and body work might affect the circulation. So in general, massage increases systemic circulation as its overall end result. The net result, the final result, is that the circulation increases. I have heard some massage therapists say, no, I heard one massage therapist who is also a physical therapist and a blogger say that there is no evidence, there's insufficient evidence to show that massage increases systemic circulation significantly enough for it to be a reliable outcome. And therefore, we can't say that massage increases systemic circulation. Bullshit. It depends on, the data that you collect. And that's anecdotal, right? What your clients tell you, what you feel is happening in the body. You work on a client's hands that are cold, they're warmer by the end of the session. It also depends on what you as a client or a recipient or a patient of massage feel and how you interpret those things. And it also depends on what you think is happening inside the body in order to fix something. We cannot see inside the body, right? We sort of see like by palpating, but we don't really know, like strictly speaking, we don't really know what is happening inside the body as a result of our therapy. But we guess, right? And it's like way past time for our guesses and for our anecdotal information to be good enough to be accepted as as fact, or at least as de facto. At least inside the walls of our own facilities, right? Inside our own community. Maybe people outside our communities want to argue about that, and that's fine, but I encourage you not to have that conversation. And it only makes things more confusing when you sit down for something like the MBLEx, because when someone gives you an exam, they have to speak almost in absolutes. They can't say, well, what's your like kind of sort of understanding of how, you know, massage sort of affects circulation by the net of the research that is available out there? You know, they can't say that. It's like, what does massage do to the circulation? And your answer should be, it increases systemic circulation. Okay, almost all techniques, almost all massage techniques, and many other techniques, non-massage techniques, like you know, stones, scraping, cupping, all those techniques, they almost all cause some temporary occlusion or stopping of the blood flow. This is called ischemia. So ISC means to suppress. We're getting into the word breakdown. We're getting into the terminology. So what I want you to do, if you ever have a term that you want to understand better, to remember it better, to be able to use it better, is to go to Google or DuckDuckGo or whatever and put in ischemia and then word breakdown. And that'll tell you exactly the different syllables, what they mean, where they come from. The word ischemia comes from the Greek ischein, meaning to suppress, and the suffix emia, which is used in terms involving blood, such as anemia or anemia, right? So word breakdowns and medical terminology are very, very useful for us because it takes the mystery out of all these words, which literally are Greek and Latin. So ischemia means to stop or to occlude or to suppress, and emia means blood. So when you press on some part of your client's body, whether you are stretching and elongating, or whether you're applying compression, or whether you're doing some kind of, you know, trigger point release or something else, there is a compression, slight compression, by virtue of your hand being on the tissues, slight compression of the skin, and therefore the vasculature in the skin. And the deeper down you go, the more structures you start to compress, and the more different types of blood vessels you start to cause ischemia in. So almost all techniques cause some amount of ischemia. There are some exceptions, like tapotement doesn't cause ischemia right away, I don't think. Also, cupping doesn't cause ischemia right away. I know I said all techniques, including cupping, but that's not, I wasn't accurate in that. So when you see the question, what is the mechanical effect of a massage technique, XYZ massage technique, tapotement, not included. What is the effect on the blood flow? Is it ischemia or is it hyperemia? The answer is almost always ischemia. And then once you let up the pressure, once you release the pressure, blood flow starts to come in, but it comes in a larger quantity, in a larger amount than before. So, you know, it's just like stepping on, well, I don't need to use an analogy. You compress the capillaries and the arterioles and venules and all that. And that slows the blood flow down, and it creates pressure on either side of the area of compression. So when you let up off the pressure, you let up off the compression, that excess pressure has built up in two directions at least, and that pushes the blood flow into the area that you've been working on in a larger amount than before. So in general, what's the effect of massage and body work? Systemically, like through the whole body after the massage, it increases circulation. And then locally, where you're pressing, it occludes or suppresses the circulation. That's called ischemia. And when you let up, the reflexive response, the response of the body is hyperemia. It allows or causes hyperemia. We'll see this again, but mechanical and reflexive are two terms you need to have down cold. Mechanical means the effect of the hand or the effect of the technique on the body. So that's what the hand does to the body. It's the first thing that happens. And then reflexive is the body's reflex. It's what the body does in response to the technique, usually after the technique is stopped. It can be a few seconds or a few hours or even a day or more after the technique is stopped. So it's the body's reflex. That's the second thing that happens. Mechanical is the effect of the hand on the body, the first thing that happens. Reflexive is the response of the body to the hand, and that's the second thing that happens. Continuing on with the what are these called, the study points. Continuing on, our second study point is to understand the different blood vessels, such as arteries and capillaries, and the functions of these blood vessels. Now, I know there are a lot of words on this slide, but once we get through them, you'll see that the concepts are broad, and I don't think it's going to be so confusing to you. And if it is, please ask so I can make it clearer for you. So artery, they carry blood away from the heart. Artery, letter A, away, letter A, right? They carry blood away from the heart. And veins carry blood toward the heart. There's no letter correspondence there. It's just, you have to remember, artery is away from the heart, and veins, by default, bring blood toward the heart. With the exception of the pulmonary blood vessels, a blood vessel, by the way, is an artery and a vein. Both of those are blood vessels. So with the exception of the pulmonary blood vessels, the blood vessels that go from the heart to the lungs and then from the lungs to the heart, arteries throughout the body, they carry oxygenated blood, and veins carry deoxygenated blood. With the pulmonary arteries, those are deoxygenated, and with the pulmonary veins, it's oxygenated. So it's reversed, right? So in the body, arteries carry oxygenated blood. So oxygenated blood is going out away from the heart into the brain, into the muscles, into the endocrine organs, into the feet. And then once all those organs and tissues absorb the oxygen, the blood is deoxygenated, and then it has to come back to the heart to be sent back to the lung. So deoxygenated blood travels through the veins, through the body, comes into the heart, and then is pumped out through the pulmonary artery to the lung, is oxygenated, and returns from the pulmonary veins into the heart. We're going to see a drawing of that, and then we're going to practice that. But if you guys are already confused, please let me know. All right. Arteries have thick walls with muscle tissue. Actually, I think veins may have some muscle tissue too, but that's not an important distinction. What's important is that arteries have the most muscle tissue. So you just think of them as arteries. Just think of the arteries as having muscle tissue. And that is because they have to contract. See, the pulse that you're feeling when you feel the radial artery at the wrist, or the jugular artery at the neck, the inguinal artery down near the pelvis, and then the artery at the foot, dorsalis pedis artery. Those pulses are not just the heart beating, it's the artery walls actually contracting and relaxing along with the heartbeat. And that is because to push the blood such a great distance, the force of the heart is not sufficient. So the arteries actually have to move the blood. They have to actually pulse, contract, push the blood themselves. So arteries have thick walls with muscle tissue, and veins have thinner walls, and they use valves to keep your blood flowing in the right direction, to keep your blood from backflowing. So unique to veins are valves, and unique to arteries are muscles. If you can memorize this here, the order of the blood flow, you will have at least 50% of what you need. So order of blood flow goes from largest to smallest and then back to largest. So it goes from the aorta to the artery or arteries, and from arteries into arterioles. And then there's the capillary exchange, right? So the arterioles turn into capillaries, and then the capillaries turn into venules, right? So venules, and then veins, and then the vena cava returns it to the heart. So if you can get used to saying a couple times a day, aorta, artery, arteriole, capillary, venule, vein, vena cava, you'll have a lot of it down. You guys go ahead and unmute. Let's do that 3 or 4 times together. So here we go. Aorta, artery. Go ahead and unmute and just jump in. Aorta, artery,
artery,
arterial,
arterial,
capillary,
capillary,
venial,
venial,
Vein.
vein,
vein,
vena cava.
vena cava,
Yeah, again, aorta,
aorta,
Artery.
artery, arterial,
arterial,
capillary, venial,
Venial.
vein,
Vein.
vena cava. You guys like my kind of monotone? Does it help make it exciting? I don't think so. Let me try a little harder for you. Okay, aorta.
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 Come on, team. Aorta.
Aorta,
aorta,
Artery.
artery,
Artery.
Arterial.
arterial,
Capillary.
capillary,
Venial.
venial,
Vein.
vein,
vein,
And vena cava.
vena
vena
cava,
cava,
I was told
I think there's like
in my class.
Vena cava.
Does it matter? Yeah.
No, it
Yeah,
doesn't
or
matter.
does it
As long
matter?
as no. Can you tell me why it wouldn't matter?
a dog is still a dog, even if you pronounce it dog.
That's right. But more, that is true, but more relevant to us is that if you can pick it out on the multiple choice on the MBLEx, you still will get it right.
Yeah,
Oh, okay. Perfect. Thank you.
Yes, you're welcome. Very welcome. Okay, let's do three on either side, capillary in the middle. Okay, aorta, artery, arterial,
aorta,
aorta, artery,
Arterial.
arterial,
capillary,
Capillary.
venial, vein, vena cava.
venial,
venial,
vein,
vein.
Very nice. Okay, I think I've tortured you guys enough. Okay, go ahead and mute yourselves. Good job, team. Veins are blood vessels. Arteries are also blood vessels. Veins are blood vessels located throughout your body, and they collect the oxygen poor blood and they return it to your heart. The job of the arteries are blood vessels that distribute oxygen rich blood to your entire body. Yeah. And okay. So please let me know if there are any questions about any of that. Okay, study point number 3 is to comprehend what occurs in the various larger structures of the heart, such as the valves and the different heart chambers. You don't have to identify the smaller aspects of the heart, like the vasculature that supplies the heart muscle to keep it alive. But you do have to know the flow of blood from the right to the left, out to the lungs and back. So this is something that you're going to have to just go in order, drill in order over and over and over again in order to remember. And hopefully when you see it on the exam, it'll be familiar enough in your mind, clear enough in your mind that you can pick it out of a lineup. Sorry. Okay, so I don't think I can make this any bigger, but I would like it to be bigger for you. So I'm going to go to our to a different document. And I'm going to go to basics, MBLEx basics, which are right here. And this one I can make bigger than the slides. The Google Doc I can expand. I can blow up bigger than the slides. Just give it a second to bring everything up. Okay, so if you go to the MBLEx basics in your MBLEx folder in Google Drive, you'll come to this graphic, same graphic, and we're going to use this. Oops, that's going to be too much. Yeah. You must be kidding me. That's as big as it can go for this. You know. There we go. There we go. Okay, guys, raise your hand if you're ready to make a mess. So from right to left, here we go. I'll take you through this twice. We're gonna toggle back and forth between this one and this one. All right, the one without the lungs and the one with the lungs. So from right to left, the blood comes in through the superior vena cava and the inferior vena cava. Sorry, that's a little bit cut off there, but it's clear in the cardiovascular presentation. Oh, no, it's not actually. The cardiovascular presentation into front, and now it's clear. So from the inferior vena cava and the superior vena cava, the blood comes into the heart, right? And this is blue on the right side and red on the left side. So blue on the right means deoxygenated, red on the left means oxygenated. Don't be fooled by the right being over here on your left. This is like, you know, the patient or the client's right. So you're facing the client, right? And you're looking at the client's ventral surface, anterior surface of the body. And inside you're seeing the chest. So this is the right and this is the left. It's reversed because you guys are facing each other. All right. So the deoxygenated blood comes in through the superior vena cava, veins carry deoxygenated blood, and the inferior vena cava, veins carry deoxygenated blood. And both the SVC and the IVC, they bring deoxygenated blood into the right atrium. So everybody look at me. Atrium, letter A, atrium goes on top, and atrium is the thing that's on the top of the house. It's like the ceiling. Some of them are made of glass, very beautiful view, very nice. Atrium is on the top. Letter V is for valley or for ventricle. Ventricle is on the bottom. So atrium on the top, ventricle on the bottom. And seriously, whenever I have students drill, they always mix up atrium and ventricle. So if you can remember atrium on top, ventricle on bottom, you'll be much more prepared than if you didn't. So superior and inferior vena cava, they bring deoxygenated blood into the right atrium. The atrium is on top. Then the deoxygenated blood goes from the right atrium into the right ventricle. Yes, the right ventricle. Go ahead and mute yourself for now. We're going to unmute and make a mess in a
I didn't even
second.
know I was on.
That's okay. That's all right. That's all right. No problem. And then when it passes from the right atrium into the right ventricle, it goes through the tricuspid valve. Now they're definitely going to ask you the difference between the tricuspid and the bicuspid valve. So I'll give you some pointers on that in a minute. So superior, inferior vena cava into the right atrium into the right ventricle via or through the tricuspid valve. Right ventricle into the pulmonary artery through the pulmonary valve, pulmonary artery to the lungs. Notice how the right atrium is smaller and the right ventricle is the bigger of the two chambers. The left ventricle is bigger, the left atrium is smaller. The ventricles are larger. The reason the ventricles are larger is so that they can contract harder because they have to push the blood out of the heart, either out through the aorta to the rest of the body or out through the pulmonary artery into the lungs. So right ventricle into the pulmonary artery, which goes through the pulmonary valve. And then we'll pick it up over here. Pulmonary arteries right here. Pulmonary artery takes deoxygenated blood into the left and the right lungs. The deoxygenated blood picks up oxygen and returns through the capillary system in through the arteries, the pulmonary arteries. So we went out from the heart into the lungs through the pulmonary veins, and that pulmonary veins, correct? Yes. And then we're coming in through the pulmonary arteries. Yes. I got that right. Pulmonary left side. Oh, no. I have those reversed. I'm so sorry. Arteries carry blood away from the heart. Hi, I'm here for the anatomy class. Arteries carry blood away from the heart. So this pulmonary artery taking the deoxygenated blood to the veins, and then the pulmonary artery takes deoxygenated blood to the lungs. The lungs infuse the blood with oxygen. The freshly oxygenated blood returns through the pulmonary veins into the left ventricle, into the heart. So it's right ventricle, pulmonary artery, lungs, from the lungs to the pulmonary veins to the left atrium or to the heart. Okay, so let's do that one more time. Just the right side to the lungs. So it's superior inferior vena cava into the right atrium into the right ventricle through the tricuspid valve, right ventricle into the pulmonary artery through the pulmonary valve, pulmonary artery into the lungs,
Can
pulmonary
you also call it
veins.
the mitral?
So go ahead
Can you
and
call it
mute
the
yourself again
mitral?
there.
I wasn't sure if
Huh?
pulmonary, the second valve,
Yeah.
is it called mitral or
Yes.
is it called pulmonary?
No, it's not called mitral. The mitral, we haven't gotten to the mitral valve yet.
Okay, sorry.
Okay, go ahead and mute yourself. Thank you very much. So from the lungs through the pulmonary veins into the left atrium into the left ventricle, and that goes through the mitral valve. There's the mitral valve, also called the bicuspid valve. And then from the left ventricle into the aorta, and the blood passes from the left ventricle through the aortic valve into the aorta. So whenever the blood goes from one of the ventricles into one of the big blood vessels, the pulmonary artery or the aorta, there's always a valve that's named for that structure. So pulmonary artery has the pulmonary valve, and the aorta has the aortic valve, right? So those two valves, there's four valves, those two valves, pulmonary valve and the aortic valve, they should be easy enough for you to guess, even if you don't remember. Now you got to figure out a way to remember tricuspid versus mitral. Okay. Well, I don't have a really great way for you to remember it, but I just committed tricuspid on the right to memory and bicuspid on the left to memory. And I also commit to memory that the mitral valve is the bicuspid valve. The bicuspid valve is also called the mitral valve. But there are different ways of remembering it. For example, you can say, you can try to be right. You know, that's not a bad one. You can try to be right. The tricuspid valve is on the right. Mitral refers to a religious hat, I believe, in Islam. So I don't really have a good mnemonic for you there. All right, so let's do the left side again. From the lungs through the pulmonary veins into the heart. When it arrives at the heart, it comes in through the left atrium. A is on top, B is on the bottom. From the left atrium into the left ventricle, passing through the bicuspid valve, aka mitral valve. You can remember BMV, bicuspid mitral valve. Be my Valentine, or whatever. And then from the left ventricle into the aorta through the aortic valve. And from the aorta, it goes through the ascending and the descending branches of the aorta. So I think those are actually called the cephalic, like to do with head. And no, cephalic doesn't have to do with head. Anyway, the upper and lower aorta, the upper one carries it to the head and the upper extremities. The lower one carries it to the abdomen, pelvis, and the lower extremities. Okay, let's make a mess. So everybody unmute yourself. Now is the time to start calling it out. Okay, remember when you practice something, when you practice memorizing something by saying it over and over again, half of the exercise, half of the way that you learn is just by forming the words over and over again in your mouth, and that actually forms a neural connection between the tongue, the mouth, and the brain. Right. And then you're hearing the words, and that's a connection between the ear and the brain. See if you can add, as you get more comfortable, another connection by looking at the structure rather than the words, and naming them by the structure, or closing your eyes and imagining the structure as you name them. Okay. But for right now, just, like repeating a phone number the first time you're hearing it. So on the right side, the deoxygenated blood comes in through the superior and inferior vena cava. Go.
Do you want the next step or to repeat you?
Go for crying.
So you just want the next step, or do you want us to repeat
No,
after?
no. Yeah. I want you to repeat. I want call and response. The
Okay.
deoxygenated blood comes in through the superior and
And
inferior vena cava.
vena cava.
Great.
Deox.
From the superior and inferior vena cava into the right atrium. From the superior and inferior vena cava
Inferior and
into the right
inferior
atrium.
vena
Right
cava
atrium.
into the right
Sweet
atrium.
cacophony. Very, very good. Very, very good. I like that you're taking your time, whoever that is. From the right atrium into the right ventricle.
From the right
From
atrium
the
to the
right
right ventricle.
atrium into the right
The right
ventricle.
atrium to the right atrium. Ventricle.
Ventricle. A on the
Ventricle.
top, V on the bottom. Good. Atrium on the top, valley on the bottom. Through the tricuspid valve. Through the tricuspid valve.
To the tricuspid valve.
Very good. From the right ventricle into the pulmonary artery.
To the right ventricle to the pulmonary.
Through the pulmonary artery. Through the pulmonary valve.
Through the pulmonary valve.
Very good. Very good. Into, I'm sorry, from the pulmonary artery into the lungs.
Pulmonary.
Good. From the lungs to the pulmonary veins.
From the lungs to the pulmonary veins.
From the pulmonary veins to the left atrium.
From the pulmonary veins to the left atrium.
Very good, guys. I can hear you getting more accurate. Very good. From the left atrium into the left ventricle.
From the left
Left
atrium
atrium to the left ventricle.
Be my Valentine, bicuspid mitral valve.
Be my Valentine.
Bicuspid valve.
Only Khalik said it, so you guys got to do it again. Be my Valentine, bicuspid mitral valve.
Be my Valentine.
Mitral valve.
Beautiful. Bicuspid mitral valve. Beautiful. From the left ventricle into the aorta, through the aortic valve.
From the left ventricle into the aorta through the aortic valve.
Perfect. You know, I usually don't give 3 structures in a row until the second time around, maybe even the third time, but you guys are a little bit sharper today than yesterday. How do I say that nicely? Okay, again, here we go. Let's bunch them up even more, all right? So deoxygenated blood comes in through the superior and inferior vena cava into the right atrium.
Deoxygenated blood comes in to the inferior vena cava into the right atrium.
Okay, one more time. Yeah, I think maybe we need to break it down a little bit still. Okay. Superior, inferior vena cava into the right atrium.
Superior, inferior vena cava.
Superior and inferior vena cava into
Yes, I would like to hear everyone. If some of you are not speaking, please speak up, even if you get it wrong. Right atrium through the tricuspid valve into the right ventricle.
Right atrium to the right tricuspid valve.
Ventricle.
Very, very good. I did not hear one person mess up the name of the valve. Very good. From the right ventricle through the pulmonary valve into the pulmonary artery.
Right ventricle into the pulmonary artery by the pulmonary valve.
to the right ventricle.
Very good. Yes, from the right ventricle through the pulmonary valve into the pulmonary artery.
Right ventricle to the pulmonary artery
Pulmonary valve.
via the mitral valve
Into the pulmonary artery.
into the
To
pulmonary.
the pulmonary artery.
Very good. The pulma are the lungs. So from the pulmonary artery to the lungs.
Pulmonary artery to the lungs.
Pulmonary artery to the lungs.
Very good. Then from the lungs to the pulmonary valve. From the lungs to the pulmonary vein.
From the lungs to the pulmonary vein.
Okay.
Very good. From the pulmonary vein into the left atrium.
From the pulmonary vein into the left atrium.
Pulmonary atrium.
Good. From the left atrium into the left ventricle.
From the left atrium
Left
into the
goes
left
into the left ventricle.
Through Be My Valentine bicuspid mitral valve.
time.
Through
Through-
Be My Valentine.
Bicuspid mitral valve.
Bicuspid mitral valve.
Bicuspid mitral valve.
Bicuspid mitral valve.
Yes, yes.
Okay.
If they put bicuspid and micuspid on as the choices and you pick micuspid. Any questions about those so far before we move on? Okay. Yes, bicuspid mitral valve into the left ventricle. Left ventricle into the aorta through the aortic valve. Left ventricle, repeat after me, left ventricle into the aorta from the aortic valve.
Left ventricle into the
aorta
aorta.
via the aortic valve.
Very good. Okay. Okay. So I'm going to just ask the whole class some basic questions, right? And you just call out. It doesn't matter if you get it right or wrong. Just listen for whether or not you are answering correctly. And if I hear like enough like disagreement, then we will repeat. I'll repeat the question. Okay. So what side of the heart receives deoxygenated blood? The left side or the right side?
The
The
right.
left side.
Right.
The right side receives deoxygenated blood. So again, what side receives deoxygenated blood? The left or the right?
The right side.
The right side. And what structure? The right atrium. Very good. And what structure brings the deoxygenated blood into the heart? Is it the superior inferior vena cava or is it the aorta?
The superior
vena
vena
cava.
cava.
That's right. That's right. Superior inferior vena cava. Which side of the heart, the left or the right, pumps out oxygenated blood?
The left.
Aorta.
Left.
The left side, that's correct. Someone said aorta. The aorta is not a side of the heart.
Left,
or
you're right.
were the
I was
choices.
thinking too far ahead.
Left. Yes, yes. And then I noticed that about you. And then the aorta carries oxygenated blood, true or false?
What was that?
No,
The aorta carries oxygenated blood, true or false?
true.
True.
And yes, very true. And does the aorta take oxygenated blood to the lungs or to the rest of the body?
To the rest of the
To
body.
the rest of the
The rest
body.
of the body.
Sharp as a laser beam, for real, for real. And now the veins, like the superior inferior vena cava, do they carry deoxygenated or oxygenated blood?
These
Deoxygenated.
deoxygenated.
Deoxygenated blood. Yes. Does the pulmonary vein carry deoxygenated or oxygenated blood?
Oxygenated.
Oxygenated, that's right. Do arteries go away from the heart or toward the heart?
Away.
And do veins go away from the heart or toward the heart?
Towards.
Away. Oh wait. Sorry.
Veins go toward.
Toward. Veins go
Yeah.
toward. Very good.
He said
Very
A is
good.
for away.
Yes. That's right. That's right. So if you're trying to be right, are you the tricuspid or the bicuspid valve? Tricuspid, that's correct. If you're trying to be right, you're the tricuspid valve. If you go to Be My Valentine, are you the tricuspid or the bicuspid mitral valve?
By
Bicuspid valve.
The bicuspid mitral valve. Yes, very, very good. Which is on top, atrium or ventricle?
atrium.
That's right.
Atrium.
Which is on bottom, ventricle or atrium?
Ventricle.
Very, very good. Which type of blood vessel has muscular walls? The arteries or the veins?
Oh,
The arteries.
Artery.
The arteries. And which type of blood vessel has thinner walls with valves to prevent backflow? Is it the arteries or the veins?
veins.
Veins.
You guys are just about right, ain't you? Just about right. All right. I tell you, I don't really think you guys need me too much more. Julie, would you like to sub for me next week? Hello?
No.
Okay. Okay.
Sorry.
Next study point. All right, everybody mute yourselves now. So next study point. Okay, comprehend what occurs in the various larger structures of the heart, such as the valves and the different heart chambers. Identify the basic categories of the components of blood. Oh, I'm sorry. This is in gray because we just did this. Ooh, can everybody mute themselves, please? And the study point we're moving on to is identify the basic categories of the components of blood and the function of these components. So the components is the stuff that makes up blood, the parts of the blood. Whole blood contains red blood cells. Get ready to mess that up. Whole blood contains red blood cells, white blood cells, platelets, and plasma. It also contains hemoglobin down here. Okay, so the majority of the blood volume is actually plasma. Which is mainly water, but it's not just water. There's a lot of stuff inside. You know, there's cells like red and white blood cells. There's nutrients. There's waste. There's the building blocks needed for like repair and metabolic processes, like proteins and ions, carbohydrates. And inside the plasma are also red blood cells. Red blood cells are also called erythrocytes. You probably will see the word erythrocyte on the exam. Erythro means red. It's down here actually. Erythro means red, and cyte means cell. Leuco means white. Cyte means cell. So erythrocyte is a red blood cell. Leukocyte is white blood cell, right? So red blood cells are erythrocytes, and their main role is to carry oxygen. They also carry carbon dioxide, but their role is carrying oxygen and carbon dioxide. I'm sorry, I don't want to confuse you. White blood cells, also called leukocytes. White blood cells, also called leukocytes. They're also in the plasma. They're part of the circulatory system. They're also part of the immune system, and they function in immune response. So white blood cells, leukocytes, they do a lot of things as immune mediating or immune causing cells. We're not going to go into all those. Just keep in mind that they are responsible for immunity. Now, hemoglobin is a red protein that actually makes erythrocytes red, and the function of hemoglobin is to bind to oxygen. So heme I believe refers to wait, let me not confuse you. So heme is believed to be it refers to a kind of a oxidation. Okay, so why don't we do hemoglobin? Okay, heme and globin. Okay, so reflecting the fact that each subunit of hemoglobin is a globular protein. So globular, like a kind of a roundish, or like several circles together or bubbles together, globulin. So that's the globin part, hemoglobin, and then heme referring to I believe referring to blood. Heme, I believe, refers to blood. And what's special about it is that it contains iron, and the iron binds to oxygen. So the fact that it contains iron, which is red, I'm recalling now, makes it red. And the thing that's special about it is that it attracts and binds to oxygen. So it is the protein that allows erythrocytes to actually carry oxygen more easily. Okay, and then platelets. So platelets are the fifth part. So we have plasma, we have erythrocytes or red blood cells, leukocytes or white blood cells, and then hemoglobin, which is in erythrocytes. And then we have platelets. And the role of platelets is to clot the blood. And we'll look at that mechanism in a moment. And this down here is just a little graphic of what red blood cells look like. By the way, in capillaries are so narrow that red blood cells have to go through single file. So I would just guess that this is some kind of, they're moving probably away from the heart. They're reddish in color, so it's probably oxygenated. So I would guess that this is like an arterial and this is a capillary, because they're going single file. Here there are a couple of them, and here they're going through single file. Okay, so now we got to talk about, are you guys completely fried, or can let me know if you need a break, okay? Otherwise, we're going to go for another 10 minutes. Understand basic concepts of the exchange of oxygen and carbon dioxide within the circulatory system, including the sites for this exchange. So, the exchange of oxygen and carbon dioxide, that's called respiration. And respiration happens across the membrane of the lungs. It also happens between the cells or the tissues of the body, like the muscles, the bones, the organs. It happens between the tissues and the blood, right? So it happens between the lungs and the blood. The oxygen comes in, diffuses across the barrier of the lung, is absorbed into the blood, and is carried to the heart. The heart pumps it to the rest of the body. And then the tissues, the cells of the body, they absorb the oxygen out of the blood and they return carbon dioxide to the blood. The blood takes carbon dioxide back to the heart, which then pumps it out through the pulmonary vein, pulmonary artery toward the lungs to reoxygenate it. Excuse me. So, so the two places where respiration happens is in the lungs or across the lungs, and then in the tissues or across the cell membranes into the tissues, right? So when it happens across the lungs, that's called external respiration. Now, I have seen practice questions that say, where does external respiration end, basically? And they say, does it end at the blood or does it end at the alveoli, right? And the answer should be the alveoli, or another way of phrasing that might be, are the alveoli part of the external or the internal respiration, right? And the answer is the alveoli are part of the external respiration because they are structured in the lungs. So if you look inside the lungs, what you find are these little grape-like clusters, and those are called the alveoli. And it's the job of the alveoli to function as like the final barrier between the blood and the outside air, actually. So all the capillaries, they wrap around the alveoli, and they have the carbon dioxide and oxygen exchange there. As the air comes in and touches the alveoli, the oxygen and carbon dioxide diffuse across the alveoli into or out of the blood. The primary means of external respiration is inhaling and exhaling. Inhaling and exhaling are the main way that we get oxygen and carbon dioxide across the alveoli, across the lungs in external respiration. In internal respiration is the gas exchange between the blood and the other tissues, or the blood and the other cells. Internal respiration, the function is to get oxygen from the blood into the tissues and to take carbon dioxide from the tissues into the blood. So if they ask you, which is internal in internal respiration? Is it the movement of oxygen across the alveoli into the blood, or is it the movement of oxygen out of the blood into the brain? The answer would be it's the movement of oxygen out of the blood into the brain, or into the muscles, or into the pancreas, or into any other tissue in the body. Which is an example of external respiration? Is it the movement of oxygen out of the blood into the intestinal wall, or is it the movement of oxygen from the air across the lungs into the blood? And the answer for external respiration would be from the air across the lungs, across the alveoli into the blood. External versus internal respiration. Now, that's not a hard concept, but there's a couple like little specific things there that I kind of like harped on, because I want you guys to be ready with those specific vocabulary words like alveoli inhaling and exhaling, lungs, blood, tissues, internal and external respiration. Do you guys have any questions about any of that? Okay, so, another way of saying that is the external respiration happens in the lungs. The internal respiration happens in or across the tissues. Okay, understanding the blood's role in healing. So they're going to ask you about the blood's role where there are cuts or tears or burns. There's more than one type of healing, right? But for what is called trauma, like where the tissue has been cut, lysed, torn. So that means in cases of cuts, that's lacerations, right? In the case of tears, that would be like a sprain or a strain, like a muscle strain is where you tear the muscle. And a sprain is where you overstretch the joint and you often tear joint capsules, ligaments, tendons, right? So in both those cases, there's also the rupturing of capillaries or the rupturing of different types of blood vessels. And when that happens, blood starts to flow out of the vessels and into the muscles or around the joints. You get the flow of blood, and you also get the accumulation of water or inflammation or swelling. So the first thing that happens in healing is that the platelets have to create blood clots. That's also called hemostasis, or the stopping of blood. It's also called coagulation, the clumping, the clotting of blood, hemostasis, coagulation. And the platelets do that. It's not necessary for you to know how. Okay, also, they also create inflammation. So inflammation means the accumulation of fluids like water. It also means a process where there's an increased metabolic activity. There's all kinds of like cell types and structures and stuff that happens. So there's like a histamine response that's created by different kinds of cells. I don't know which ones. That creates like redness, sometimes itchiness, the feeling of burning, a distension, right? There's also signaling that happens between cells, like different kinds of immune cells, like white blood cells and T cells. They actually create like different kinds of substances, they're called, like P substance, and I forget examples of the others, but I believe that P substance actually increases pain. Other kinds of substances, they interact with different cells and they tell them to become more active. So the immune activity in an area starts to ramp up with inflammation. The purpose of inflammation is to increase the metabolism in the area, to start to increase the repair, the cleanup and the building back up of structures that have been damaged. So platelets first create blood clotting or hemostasis or coagulation, and they create inflammation. Inflammation brings water, but also blood to the area, increases the blood flow. So the blood vessels dilate in order to bring in more blood. More blood comes in the form of red blood cells or erythrocytes, right? And with them, they bring in oxygen and they start to clear out waste products, especially carbon dioxide. Now, in 2 weeks, 3 weeks, 6 weeks, whatever it is, depending on the injury, the inflammation has to start to subside. The swelling goes down, the heat goes down, the irritation, pain starts to reduce, because much of the metabolic cleaning out and building up that needs to happen has taken place, right? So the job of the erythrocytes is also to reduce inflammation in the later stages when it's appropriate. So platelets clot the blood and create inflammation. The blood vessels dilate. They dilate to open, and you guys should know this term. Anyway, dilate means open. Okay, dilate means open. Vaso, you'll see sometimes like vasodilate. Vaso means vessels, so the blood vessels dilate or vasodilate to bring in more blood. red blood cells arrive, they bring oxygen, they carry away carbon dioxide waste. They also in later stages will reduce inflammation when it's appropriate. The job of plasma in all of this is to transport all this stuff. I'm actually going to move that bullet point down because that's kind of like makes a little more sense to me in last place. White blood cells or leukocytes, they protect the wounds from infection. They also do like, some other stuff, but just protecting them from infection or creating an immune response is sufficient, right? Hemoglobin, the role of hemoglobin, which is found inside erythrocytes, carries the oxygen. So the role of hemoglobin is that it allows the erythrocytes to actually bring oxygen to the area. And the job of plasma is to function as the big transportation system. So the blood vessels are kind of like, there's subway here in New York. And the blood vessels are kind of like the tunnels, and the plasma is like the trains, right? And then all the stuff that's in the trains, that's like the red blood cells with the hemoglobin and oxygen, the white blood cells and the platelets. Right, so the plasma transports everything, and it also transports a lot of other stuff, which we have to get into, but it kind of helps to contextualize things if you know that they're there. So waste products, nutrients in order to repair stuff, all the cells we mentioned, clotting factors. Okay, that may be it for the circulatory system. Is that it for our? Yeah, but I don't think that that's actually it for all of the study guides. I think there may be some others which we did not cover. Yeah, there are some others. So we stopped here, understanding the blood's role in healing, the functions of basic blood cells like erythrocytes, leukocytes, lymphocytes, and thrombocytes we did not cover. Identify the major pulse points on the body. I'm going to do that for you now. So the major pulse points on the body are the jugular vein, right? The jugular vein, and then the radial, like radius bone, the radial artery. I'm sorry, not jugular vein, jugular artery. There's no pulse in veins. There's only a pulse in the arteries. Jugular artery. And then there is the radial artery. And that's probably the only two you need. Although I would try to remember that there's an inguinal, like inguinal fold. There's an inguinal artery. And there's also an artery at the top of the foot, which is called the dorsal pedalis. We identified major blood vessels like carotid artery, femoral artery, others of this magnitude. No, we didn't really do that. Understand blood pressure. No, we didn't cover blood pressure. So these please look those up on your own. But yeah, please look those up on your own. And then just to be clear, things that you don't need to know are the minor blood vessels, smaller structures of the heart, including the minor blood vessels, memorizing all the different types of white blood cells. I think there's 3 or 4. Explain the function of specific white blood cells, identify the cascaded chemicals responsible to allow blood to clot. Not necessary. Okay, so it's 7:02, almost 7:03. Let's take a break. Come back at 7:13. Okay, it's 7:02. Come back at 7:13 Eastern time. Come back at 7:13 Eastern time. Resume recording. And how about we do the foot? Let's do the gastro. Oh, okay. So here we have a human leg. This is the femur, this is the tibia, and the fibula. This is also called the lower leg. This whole thing is the lower limb. This is the upper limb. And this is the lower leg. Now, in the lower leg, we have the gastroc in the back, and underneath the gastroc, or anterior to the gastroc, is the soleus. Now, these are both plantar. They're both plantar flexors, right? So they do this. The job of the gastroc and soleus is plantar flex the ankle. I believe the gastrocs, but not the soleus, also flex the knee. And the job of the tibialis anterior, which is the muscle in front next to the tibia, is to dorsiflex, the ankle, right? To dorsiflex the ankle. So when we are doing dorsiflexion, which one is the prime mover? Is it the tibialis anterior or is it the gastroc and soleus? You guys unmute yourself and tell me what you think. Am I coming through? Can you guys hear me?
Yeah, I didn't. Could you repeat the question?
Yes, yes. Yeah, looks like people are unmuting now. Good. Okay, so I want to know if we are looking at an ankle that is dorsiflexing, which one is the prime mover? Is it the tibialis anterior or is it the gastroc and soleus?
The anterior,
The gastro.
tibialis anterior.
That's right, it's the tibialis anterior. So for the person who said, by the way, does it look like my picture is going in and out? Are you getting my picture and then someone else's? Say that again for you, what?
For me, it's going in and out.
Okay, let me just, let's see. So I think I have to click. Could not be showing you at all because I have hide non-video participants and you guys have your video off. So let's see, show non-video participants and then hide non-video participants. And then let's try gallery instead. Okay, someone say something. Jessica or Gisela or Khalik or Jennifer, anyone who's unmuted, say hello. Let's see if it switches.
Hello.
Hello?
Still
Yeah, it
switching,
switches.
isn't it?
Yes, it switches.
Yeah.
Okay, I'm sorry. Looks like maybe that's a setting that I'm going to have to do later, but I don't think that it's going to let me. I don't think it's going to let me do that. Yeah, I don't want to spend any time on this, but oh crap. Okay. That's too bad. All right, we're just gonna have to deal with it like this. All right. So another way of thinking about whether or not the muscle that's the prime mover is the tibialis anterior or whether it's the gastroc and soleus is to just think front and back, right? And then to go from there. So if we're talking about dorsiflexion, is the prime mover in the front or in the back?
The front.
The front. And if we're talking about plantar flexion, is the prime mover in the front or in the back?
The back.
In the back.
Okay. Okay. And while we're on plantar flexion with the prime mover in the back, what's the name of the muscles back there? The muscles in the back of the lower leg.
The gastrocnemius and the soleus.
Gastroc and the soleus. That's right. And if we're talking about plantar flexion with the prime mover being the gastroc and the soleus, are these the agonist or the antagonist?
Agonist.
The agonist, very good. And for dorsiflexion, is the tibialis anterior the antagonist or the agonist?
Agonist.
Agonist, very good. You guys are a little bit sharper this week than last time. That's great. Okay, so now let's look at, so we did ankle, right? So now let's look at knee flexion and extension. So for knee flexion, we're talking about the hamstrings and as a synergist, the gastroc, but mainly the hamstring. For knee flexion, right? And this is extension, that's the rectus femoris or quads and this is the biceps femoris, or the biceps and the semis, which are the hamstrings. So for flexion, are we talking about the agonist being in the front or the back?
Front.
So for flexion, the agonist would be in the back. All right, now for extension, the agonist would be in the front. What's the name of the agonist in the front in knee extension? What's the name of the agonist in the front when you do knee extension?
Quadriceps.
The quadriceps muscle, yes, also called the what femoris, biceps or rectus?
Bicep.
The rectus in the front, biceps in the back, right? The biceps always does flexion, Kalik. So the biceps femoris does flexion of the knee, the biceps brachii does flexion of the elbow, all right? And if we're talking about knee flexion, where is the agonist, in the front or in the back? In the back, that's correct. What's the name of the muscles in the back?
Bicep femoris.
Bicep femoris, also the semis, collectively called the hamstrings. So you have the hamstrings as the agonist, and what's the antagonist in knee flexion? What's the antagonist in knee flexion?
The quadricep.
The quadricep muscle, that's right. Okay, for adduction, not abduction, but a deduction, which muscles are the agonist?
Would it be the adductors?
It would be the adductors. And for abduction, which muscles would be the agonist?
Sartorius. Inside of the
not
leg.
sartorius. No, it actually, for abduction, abducting away from the midline, adducting toward the midline. So for abducting away from the midline, we're talking about the gluteus minimus and the TFL. Gluteus minimus and the TFL. Right? So
Okay.
adductors, adductor magnus, adductor brevis, pectineus, we'll go over those more specifically another time. And then the abductors, glute min and TFL. So you can just say glute min for abduction, and you can just say adductor group for adduction, okay? So if I am adducting, which group is the antagonist? If I am adducting, which group is the antagonist?
Yeah, abductors.
The abductors, right. And if I am abducting, which group is the antagonist?
The adductors.
Gluteus.
The adductors, I'd like you to say adductor, abductor. Adductor. So, yeah. Okay, good enough for now. Okay, let's do now hip flexor, which in part is the iliopsoas muscle, and in part is the rectus femoris muscle. I have to pause because I often confuse rectus femoris and biceps femoris, okay? And I just remind myself the biceps does flexion on both the lower and the upper limb. The biceps does flexion, and the rectus makes it straight or upright, right? Rectus abdominis muscle, rectus femoris muscle. Okay, so hip flexion and hip extension. So hip flexion, hip extension, right? So in hip flexion, which surface, the front or the back, which surface is the prime mover in hip flexion? The front or the back?
The front.
The front. And what's in the front? The hip flexors or the glutes?
Hip flexors.
That's right. And in hip extension, which is the prime mover? The hip flexor? I'm sorry, the front or the back? Let's start front or back?
The back.
The back, that's correct. And what's in the back? The glutes or the hip flexors? The glutes, that's correct. Okay, now let's do it didactically, right? So a person is kicking a ball toward the front, right? Kicking toward the front. Which muscle group is the agonist? Which muscle group is the agonist? The hip flexors or the glutes?
The glutes.
Hip flexors.
So is the
Hip flexors, if you're striking back your leg to kick forward, right?
oh no, not striking back, not winding up in extension
Oh.
to kick forward in flexion. No, kicking a ball in front Kicking a ball in
Okay.
front, kick, right? So kick is hip flexion. Kick is hip flexion. Okay. What's a movement that we do? Name me a movement that we do for hip extension. What would we do in hip extension?
Tender.
Bridges.
Bridges?
Let me see. Is it?
Kickbacks.
How about lunges? Okay. So when doing a lunge with the leg in question, when doing a lunge with the leg in question in the back, the leg in question in the back, that's an extension. Which surface of the body is the antagonist, is the agonist? Which surface of the body is the agonist? The back surface or the front surface?
Back.
The back.
The back surface. And what's in the back? The glutes or the hip flexor?
The glutes.
Glute.
The glutes, that's right. Okay, now let's do all of that again, the front and the back, flexion and extension, kind of a little bit more abstract, okay? So a runner is running with the left foot forward, and the right foot back. Is the left leg in flexion or extension?
Back.
You said left foot back, right foot forward.
Left foot forward, right foot back. Left forward, right back. So is the left in flexion or extension?
Flexion.
Left is inflection.
The left leg is in flexion, left hip flexion, that's right. So which muscle is the antagonist? Which group is the antagonist for the left hip inflection? Is it the hip flexor or is it the glutes?
I don't know.
The
Glutes.
agonist for the left hip, which is in flexion, is it the hip flexor or is it the glutes?
It's the hip flexion.
The hip flexor is the agonist.
Hip
Name
flexor.
the antagonist. Name the antagonist. The glutes, that's correct.
Glutes.
The glute.
That's correct.
Agonist.
That's correct. The right leg is behind behind the body. And that's in what? Hip extension or hip flexion?
Hip extension.
Extension, that's right. Name the agonist and the antagonist in hip extension in order. The agonist and then the antagonist.
So the agonist is the glutes, and the antagonist is the right hip flexor.
Yeah.
Everybody agree?
Yes.
Great. Fantastic. Okay, great. Okay, now let's move on to the abdomen and the thorax. All right, so for this one, we have the, let's say, abdominals, okay, rectus abdominis, and then we have the, let's say, the spinal erector group, right? And remember, this is the front of the body, this is the back of the body. All right, so in spinal extension, which surface of the body is the agonist? Is it the back surface or the front surface?
Back.
The back surface. What's in the back surface? The abdominals or the spinal erectors?
Spinal erector.
Spinal erectors.
Yes. Name the agonist and the antagonist in spinal extension in order. Name the agonist followed by the antagonist.
Agonist is the
Agonist is the spinal. Agonist is the abdominal.
The antagonist is abdominal. Did you say antagonist for abdominal?
No, I said abductor. Abduct.
Okay, so it's not abductor, it's not abductor. Those are over here, right? So it's a agonist in this case for spine extension. It's agonist is the spinal erector group, and then antagonist is the abdominal. Antagonist is the abdominal. Okay, now we're going to go the other way. We're going to go into spinal what?
flexion.
Flexion.
Spinal flexion. Very good, very good. So where is the prime mover? In the front or the back?
Front.
Front.
Correct. Name the antagonist and the agonist in spine flexion in order. The antagonist followed by the agonist.
Antagonist is
Spinal and the agonist is the abdominal.
agonist is
Fantastic, fantastic. No lie, no lie. Okay, flies. Who's fly? Okay, never mind. So doing flies to the front, these are the pectoralis muscles, right? If you do flies to the back for shoulder blade retraction, those are, let's just say the rhomboids, okay? It's more than the rhomboids. Let's just say the rhomboids for retraction, and then for flies to the front or some protraction, it's the pectoralis major, okay? Yeah, I know the serratus anterior does true true shoulder blade protraction, but we're talking about flies. Okay, we're talking about a movement of the arms. So flies to the front. Where is the prime mover? Is it in the front surface or the back surface?
The front.
The front. And what muscle is doing the fly? Is it the pec or is it the rhomboids?
The pec.
The pecs.
Back.
Right. So which one is the antagonist?
The antagonist would be the back.
The rhomboids.
Yes, the rhomboids. And which is the agonist? Just
The pecs.
the pecs. That's correct. And a back fly, the shoulder blades retracting. Which muscle would be the antagonist?
Pecs.
X. Or the first one would be
The pecs are the antagonist, and which is the agonist in a back fly?
The rhomboids.
rhomboid.
The rhomboids. That's right. That's great. That's really great. That's really, truly great, guys. That's awesome. Okay. This is a deadlift, right? Also called a hip hinge. This is a deadlift, right?
Mhm.
And this is a squat. Okay. In a deadlift, at the bottom right here in the deadlift, which surface is working more? The front surface or the back surface?
Front.
Back.
Let's say that it's the back surface, okay? Let's say it's the back surface at the bottom of the deadlift, all right? And so does that make it the prime mover?
Yes.
Yes, and which muscles are the prime movers?
The glutes
The
and
agonist.
The glutes and the what?
hamstrings.
I would say glutes and hamstrings, yes. And then on the way down, which one is the, wait, hold on, how do I need to ask this? Okay, no. At the top, first, coming back up to the top, which one is the agonist? Coming back up on the way up, which one is the agonist?
Glutes.
Still the glutes, still the hamstrings, that's right. So the antagonist would be
Traps.
the hip flexor, because that antagonizes the glute. And what antagonizes the hip string, the hamstring? What antagonizes the hamstring?
Worse.
The quads. Okay, this is a squat. Here. Okay. Which surface is being worked most at the bottom of the squat, holding the bottom of the squat? Which one? The front or the back? The front surface.
Yeah.
What's on the front surface? Yes. What's on the front surface? What's the prime mover in the front?
Your quads.
Triceps.
The quads, that's right. And also some of the hip flexors. Okay, and then standing up is also the quads. Okay, now let's get into I think you guys have most of the antagonist agonist. Now let's start to pair the eccentric concentric with it. Okay. So on the way down, are the quadricep muscles, are the quads lengthening or shortening?
Shortening.
Shortening.
Okay, look at the, they're actually lengthening, right? So.
You said the quads?
The quads, right? So if you look at my knee, look at my knee and look at my hip, those angles are starting to change, right?
Oh.
They're starting to change, you see? Right, and then on the way up, they will, let me make sure I'm getting this right. No, I'm sorry, you're right. They're shortening on the way down and they would lengthen on the way up. So on the way down, is that a concentric contraction of the quads or eccentric? Concentric. And as you're going up, very good.
Eccentric.
Very good. Very good. Eccentric and concentric. Very good. Okay, I need to break this down a little bit because there are two ways of expressing concentric and eccentric. One is the whole body moving down. So the phase of the squat as you're moving down is called the eccentric phase, right? And the phase moving up is the concentric phase. But not every muscle is moving concentric on the way up. Not every muscle is moving eccentric on the way down. The phase is concentric. The phase is eccentric down, concentric up. So let me break the muscles down one by one in front back pairs like we did before. Okay, so if we're doing let's say hip flexion, the muscle that's shortening is where? In the front or in the back?
In the back.
Actually, imagine the hamstrings, which are in the back. Okay, they attach here, right? And imagine that the knee is coming up. What's happening to the hamstrings? Are they getting shorter or are they lengthening?
They're stretching.
Oh,
They're stretching, they're lengthening. That's right. So if a muscle lengthens, Julie, if a muscle lengthens, is it eccentric or is it concentric contraction?
say it again. I'm sorry.
If a
If a
muscle
muscle-
lengthens, is it contracting eccentrically or concentrically?
Eccentrically.
Eccentrically, that's right. Okay, now someone else, the quads. As we move the hip into hip flexion, are the quads contracting eccentrically or concentrically?
Concentrically.
Concentrically, yes. Yes. Gisela. Gisela.
Oh, sorry, yes. I thought I unmuted
Hi,
it.
Gisela. Yeah, Gisela. So why are the quads contracting concentrically in hip flexion? Why?
Because you're moving, well, the rotation, right? When you're flexing
Because they're
your
shortening.
glutes, your leg.
Mm, No, I wouldn't say rotation. I wouldn't say rotation. Rotation is like this, okay? Internal and external rotation, right? This is not
Oh, okay.
rotating, okay? This is flexing and extending, right? So when the reason is because when you do flexion, the quads shorten. Shortening is concentric, and lengthening is eccentric. Okay, not off the hook yet, Gisela. Not off the hook yet, Gisela. All right. So now let's go down to the ankle again. All right. So pick one: dorsiflexion or plantar flexion.
Plantar flexion.
Plantar flexion. So plantar flexion is this way. Which muscles are shortening?
I can't see you. Sorry.
Okay. All right. Okay. So in plantar flexion, which muscles are shortening?
Dada.
Gisela. Okay, let's move on. I think Gisela may have been. I think maybe there's a microphone problem or something. So in plantar flexion, which muscles are shortening?
The
Anybody? The gastrocs. And does that mean that the gastrocs are concentric or eccentric contracting?
Concentric.
Concentric. Where's the eccentric contraction in plantar flexion?
It's the tibialis
In
anterior.
the front, which is the tibialis anterior. Yes, very good. And that reverses if we do dorsiflexion. So in dorsiflexion, we have the tibialis anterior in the front and the gastrocs in the back. Where's the concentric contraction in dorsiflexion?
In the front.
The front.
In the front. And that name of that muscle is the
Tibialis anterior.
tibialis anterior. And the eccentric contraction is in
The gastronomic.
Yes.
the gastrocnemius and the soleus muscle, gastrocnemius and the soleus muscle. Very good, guys. Very, very good. Very good. Okay. End range of a squat, right? The glutes are contracting, right? The hip flexors are lengthening. So we have shortening in the back and lengthening in the front. Where's the eccentric contraction? Eccentric.
In the front.
In the front.
In the front, AKA the hip flexors. And where's the concentric contraction? Name of the muscle, please.
The glutes.
The glutes, yes, glutes. That's right. That's right. Lowering the head down toward the ground. What is this called? Flexion or extension?
Flexion.
Flexion.
And where is eccentric? Where is concentric?
Eccentric is in the back and concentric is in the front.
Great. Can you use the words extensors and flexors now?
Okay. So the extensors are the eccentric and the flexors are the concentric.
Very good. Very good. Is anyone confused about eccentric and concentric? Does anyone need more eccentric and concentric?
I do. Sorry.
You do? Okay. Okay, you want to do, all right, you guys want to do shoulder, elbow, wrist, or you want to do the same ones we have? You want to repeat the ones we have, or you want to do a new area?
Do the
Same
shoulder.
Okay.
Sorry.
Doesn't matter.
Oh, it doesn't matter? Okay, okay.
For me,
So
any area.
any area? Okay, great. Great. So for shoulder flexion, the anterior deltoid is a prime mover and it is opposed by the posterior deltoid. For shoulder extension, the posterior deltoid is the prime mover and the anterior deltoid opposes the posterior deltoid. So in shoulder extension, where is the concentric contraction? The posterior delt or the anterior delt? Concentric contraction.
Anterior delt.
Concentric contraction is shortening, eccentric is lengthening. Extension of the shoulder would shorten which fibers?
Okay, then it's the back of it.
And lengthening, it's like eccentric. And when shortening, eccentric.
Yes, when lengthening, it is eccentric. And where's the eccentric contraction? In the anterior deltoid or the posterior deltoid?
Anterior.
Anterior deltoid, very good. Where's the agonist?
Yes.
The agonist is still in the front in that case, isn't it? You always ask for
Which
one.
one is
That's always the antagonist.
Which one is the prime mover?
The shoulder.
The shoulder is a region. The shoulder is a region. We're doing shoulder extension. Okay, which one is the prime mover in shoulder extension? The posterior deltoid or the anterior deltoid?
Why the
The prime
posterior?
mover. The posterior deltoid. The fibers of the posterior deltoid. No. Posterior deltoid in extension. Posterior. So everybody repeat after me. Shoulder extension.
Shoulder.
Shoulder extension.
Posterior deltoid.
Posterior deltoid.
Deltoid.
And shoulder flexion, anterior deltoid.
Shoulder.
Shoulder flexion. Anterior deltoid.
Very good. I like you taking your time. Shoulder extension, the posterior deltoid is the agonist.
Shoulder.
Shoulder.
Extension.
Shoulder extension.
Posterior deltoid.
Posterior deltoid.
Is the agonist.
Is the agonist.
Where's the agonist?
Very good. Okay, everybody take your arm and put it please into extension. Put it into shoulder extension. Okay. Shoulder extension. Take your other hand and touch the back of your shoulder. So touch your posterior deltoid fibers. Feel them contracting and shortening.
Yeah.
Right. So with your arm behind you, I want you to say shortening, agonist, concentric. Shortening, agonist, concentric. Shortening, agonist, concentric.
Shortening.
Stay there. Keep your shoulder in extension and move your hand around to the anterior delt. And I want you to say lengthening, eccentric, antagonist. Lengthening, eccentric, antagonist. One more time. Lengthening, eccentric, antagonist.
Antagonist.
Very good. Now we're going to do shoulder flexion, okay? And keep your palpation hand in the front on the anterior deltoid. This is the anterior deltoid is shortening. Anterior deltoid is shortening.
Yes.
Repeat after me. Anterior deltoid is shortening.
Anterior deltoid.
Concentric.
Anterior deltoid is shortening. This is the agonist, concentric, shortening. Agonist,
Agonist.
concentric,
Concentric.
shortening.
Shortening.
Agonist,
Agonist.
concentric, shortening. Prime mover.
Shortening.
Very good. Now stay in shoulder flexion and sneak your hand around to, I tell you, it's just like when I used to get in trouble and they make me stand like this for like, okay, so posterior deltoid is lengthening. Posterior deltoid is lengthening.
Lengthening.
Posterior deltoid is lengthening.
Very good, very good. Okay, this is lengthening, eccentric, antagonist. Lengthening, eccentric, antagonist.
Antagonist.
Good. Lengthening, eccentric, antagonist.
Lengthen, eccentric,
Lengthening.
antagonist.
Antagonist.
Very, very good. Very, very good. Okay, let's move on to external and internal shoulder rotation. Okay, so external rotation, which muscle for the most part does external rotation of the shoulder? Which one does external rotation of the shoulder? Is it the infraspinatus or the subscapularis?
Subscapular.
Subscapular.
Subscapularis does internal rotation.
It's the infraspinatus.
Infraspinatus does external rotation. Right. So in external rotation, which muscle is shortening? The infraspinatus or the subscapularis?
Infraspinatus.
The infraspinatus. That's right. The infraspinatus is shortening. It is the agonist. The infraspinatus is shortening. It is the agonist.
Shortening is the agonist.
That's right. That's right. Infraspinatus, shortening, agonist, concentric. Infraspinatus,
Infraspinatus,
shortening,
agonist,
concentric,
That-
agonist.
Agon.
Great. And then where's the antagonist in external rotation? Which muscle is antagonizing external rotation?
pectoral
The infraspinatus or the infraspinatus or the subscapularis?
Subscapular.
Subscapularis.
Subscapularis. Very good. Subscapularis. Okay. Now internal rotation. Internal rotation is which one? The subscapularis or the infraspinatus?
That's the first one, as you said.
Infraspinatus does external rotation. Which one does internal rotation?
Subscapularis.
Internal.
Subscapularis.
That's the subscapularis. Correct. Which one is shortening? The subscap or the infraspinatus?
Infraspinatus.
Yes.
Which one is shortening? The subscap or the infraspinatus?
Subscap.
The subscapularis. That's right. External rotation. Which one is shortening? The infraspinatus or the subscapularis?
The infra.
Very good. Which internal rotation? Which one is shortening? The subscapularis or the infraspinatus?
Subscapular.
Subscapularis. Very good. Very good. Where's the agonist? Which one is the agonist in internal rotation? The agonist, the subscapularis or the infraspinatus?
The infraspinatus.
In internal rotation, the subscap or the infraspinatus? The subscapularis. In external rotation, which one is the agonist? The infraspinatus or the subscapularis?
Infraspinatus.
Okay, so now I'm gonna say like shortening. I'm gonna go like this and say shortening, and you say infraspinatus. I'm gonna go like this and say agonist. You're gonna say subscapularis. All right, I'm gonna go like this and say concentric, and you're gonna say infraspinatus. Okay.
Okay.
So for experimentation. Okay, just a second. Give me a chance. So this is a shortening. Which fibers are shortening?
Infraspinatus.
Very good. Which fibers are shortening?
Subscapularis.
Very good. Which muscle is the agonist?
Infraspinatus.
infraspinatus,
Very good. Which muscle is the agonist?
Subscapular.
Very good. Which muscle is concentric?
Subscapularis.
Uh-uh.
Infraspinatus.
Infraspinatus. Concentric. Which muscle is concentric now?
subscapularis,
Subscapular.
Subscapularis. Which muscle is eccentric? Careful.
subscapularis,
Infra.
Subscapularis. Very good. Which muscle is eccentric now?
infraspinatus,
Very good. Which muscle is no, I'm joking. Okay, look, we have to practice some internal and external rotation, okay? Because you guys are like kind of not perfectly clear on this, okay? So I want you all to look at your humerus, look at my humerus and your humerus, and let's just start with the same position that we started with, which is the elbow by the side and the elbow at 90 degrees. So this is external rotation. Look at the way your humerus is moving. And this is internal rotation. So I want you guys to say external rotation and then
External
internal rotation.
rotation,
Good. One more time. External rotation
external,
External rotation.
and then internal rotation. My battery's dying, so I'm going to switch to my.
Internal rotation.
Good. So I'm switching to this one here because the battery on the other one's dying. I apologize. So we just did external rotation and internal rotation. Okay, back to the starting position. Now just straighten your elbow, extend your elbow, right? And I want you still to look at your humerus. Mind flip, right? Look at your humerus. External rotation,
External rotation.
internal rotation.
Internal rotation.
Yeah, external rotation,
external
rotation.
internal rotation.
internal,
Internal rotation.
Great. Okay, now let's go to a T. All right, just one arm in the T. All right, so external rotation
External.
External
External
rotation.
rotation.
Good. Internal rotation.
Internal
Internal
rotation.
Good.
rotation.
External rotation.
External rotation.
External rotation.
Internal rotation.
Internal rotation.
Great. Now we're going to go to a W, okay, also called a goalpost. All right, so here's the W. It's the same as the one we just did, just with the elbow bent, right? Mind trick, right? Okay, external rotation,
External rotation.
internal rotation,
Internal rotation.
external rotation,
External rotation.
internal rotation.
Internal rotation.
Very good. Okay, now I'll do the movement and you guys name it. Okay, ready?
Internal.
Internal rotation.
Very good.
External.
External rotation.
Very good.
Internal rotation.
Internal rotation.
Very good. Very good.
External rotation.
External rotation. Very good. Very good.
External
External.
rotation.
Good.
Internal.
rotation.
Great. Great.
I did not see you.
Oh, that's
Yeah, you
okay.
keep going in
I'm
and out.
sorry. Oh, really?
Yeah, I can't see you.
Yeah.
What are you seeing? What are you seeing? You seeing me and then
It goes
someone else who's
black.
speaking?
Yes.
Yeah,
Yeah.
it goes black,
Yeah.
black with the little person and then you
Oh,
back and forth.
you have to pin him because it was doing that for me too. So I just pinned you.
Oh, how you pin somebody?
So you go
do
into
you pin?
participants and then you go
Go to
to
the little
name,
dots in the corner.
and
Oh,
then
okay.
you put more and it's gonna put pin.
Lucas, I didn't.
And I just pinned myself and hopefully that's going to be that. So, oh,
know.
no,
Yeah,
actually,
I
I'm
just
still going
pinned
in
you.
and out.
Okay,
Okay.
I think I got it.
Okay. Okay. So I'll just slow down a little bit and I'll watch. I have like my phone as a feedback with a monitor. So I'll watch that. Okay. So let's go through them again. Just 4 positions this time, not all of them. Okay. So this way.
Internal
External.
rotation.
External
Oh,
rotation.
that's external.
I thought it was
External rotation.
Oh, that one's external.
External rotation.
Can see it.
That's it. That's
It's
okay.
going away
Okay.
from-
Well, everybody stop talking so I can reappear. Here we go. So this external
External.
rotation. Yes, everybody stop talking. Don't talk yet. Don't talk yet. Look at the way my arm is going. Look at the way my humerus is going. That's what, internal or external?
External.
External.
Yes, we have consensus. That's great. Okay, everybody stop talking for a second. Okay, now the other way. Oh, sorry, you do it. The other way. Look at the way my elbow is moving, look at the way my humerus is moving. Internal or external?
Internal.
internal.
Internal, yes, we have consensus. That's awesome. Hi. Okay, now last 2, right? Goalpost or W position. All right. So which way is this? Internal or external rotation?
Internal.
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 Internal rotation. Which way is this? Internal or external rotation?
External.
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 External rotation. Very good. I think you guys almost have it. Okay. Which one is it? Which one is the agonist?
Subscapulary.
Sorry.
Spinatus.
Try again. Right here. External rotation.
The supraspinatus. What is that?
The agonist is the infraspinatus. The agonist in external rotation is the infraspinatus. Okay, now we're doing what? Internal or external rotation?
Internal.
Internal.
Subscapular.
Internal rotation. Internal rotation. And which muscle is the agonist in internal rotation?
Subscapular.
Subscapularis. Everybody agree? Okay, great. Okay, great. Okay, new position. All right. Agonist.
External.
External rotation, correct. What's the agonist?
Infraspinatus.
Yes, everyone agree?
Yes.
Yeah.
Infraspinatus, very good. Okay, now this one.
Internal. Subscapular.
Internal.
Internal rotation and the agonist is the subscapularis. Very good. Very good. Okay, I think I tortured you guys with that enough. Let's finish up by looking at a couple of the muscles of the shoulder. All right. Unless you guys have any questions about any of that. Does anybody have any questions about that?
I got some written here that write down like like what we were talking about earlier, like when you're shortening the muscle, it means it's concentric and it's agonist. Am I right? And that concentric
Yes.
muscle, it's concentric and it's agonist, and when you lengthen the muscle, it's eccentric.
Yes, you'd like to know if it is written somewhere, concentric, eccentric, agonist and antagonist.
Confused for that.
Is that the question?
Yeah, like if we're shortening the muscle, it means it called like concentric and it's agonist. Is that
Yes. Okay, so I don't have that, but I'll put it in the MBLEx basics and I'll write it down right now. So
If you're lengthening, you're always eccentric. Is that right?
yes, lengthening is eccentric. Give my computer a minute to catch up.
Okay.
There we go. Okay, so concentric, con like with is shortening, which is agonist.
yeah, that's what
All
I'm
right.
right.
Also prime mover.
Okay.
Okay. And then eccentric is lengthening. That's when the muscle, yes, when the muscle contracts through lengthening, and it's the antagonist. All right. And it's, I believe it's that simple. It's really that simple. Synergist, we haven't discussed very much, but we'll get there. Okay. So concentric, shortening, agonist, prime mover, eccentric, lengthening, antagonist.
Doesn't matter if it's external or internal, like shortening is like external, like what you're showing, the arm, like external.
Yes.
Or internal moving its rotation, or is like lengthening. I'm not sure.
I'm not sure exactly what you're asking. I'll attempt to answer. So when externally rotating the shoulder, the prime mover, the muscle that's shortening is the infraspinatus. The infraspinatus is concentrically contracting.
Yes.
Shortening, it is concentric, it is the agonist, it is the prime mover. With internal rotation, the infraspinatus is lengthening, meaning it's eccentric contracting, it's the antagonist.
It's
The
all like,
subscap.
yeah, it's all together, like, you know, like it's possible, like when you move the internal, there is a lengthening and eccentric happening. Am I right?
In any movement of the body, there is always an eccentric lengthening and a concentric shortening. The shortening happens on one side and the lengthening happens on the other side.
Yes.
Your job is to learn which muscle does what movement. So the infraspinatus does external rotation. When it does external rotation, it's shortening, concentric contraction, agonist.
Yeah, so we have to know that.
It's opposed or antagonized by the movement on the other side of the scapula. The subscapularis muscle is the antagonist. It lengthens eccentric contraction.
Yeah, got it.
Yes. Okay, we have to stop. We will work these a little bit more next time. You guys are legit sharper with this than last time. I hope you can tell. And you'll get there. All right.
Thank you.
So I hope you guys, you're welcome. You're welcome. I hope you guys are planning to come to the extra classes on Thursday and then Saturday and Sunday.
Yes.